Now, New York's #1 news. Channel 7 Eyewitness News.
Up next on Eyewitness News, first before protecting yourself from foot surgery, there are other ways to treat bunions. Dr. Parikh with these simple ways you can stop suffering from fashion. Well, whether you are a fashion victim or a fashionista, most women know that fashion comes at a price. Unfortunately, it can hurt a lot more than just your wallet. We're talking about your feet and all those really pretty platform stilettos.
Now, the result, in many cases, is bunions, which can be embarrassing and painful condition. But Dr. Parikh here with some simple solutions to avoid surgery.
Yes, no one wants to talk about bunions, which is why we are going to talk about it. So yes, check out your own feet, check your feet. We have 5 simple ways to keep the problem from getting worse.
I was like, well, why do I have pain here? Then I realized that the bone was popping out, and I was like, oh, gee, a bunion.
Kenya Sally is a nurse, which means she's always on her feet. And like so many women, she has a bunion on her foot, the small bump at the bottom of her big toe.
I had pain all here.
Bunions can be genetic, but they're often caused from cramming your feet into those sexy, pointy, high-heel shoes.
I'm a person who loves heels, so it's a very big problem for me.
Dr. Neal Blitz is the chief of foot surgery at Bronx Lebanon Hospital Center. He says most people think a bunion is a growth on the bone, but that's not true. It's actually caused when the bone itself is pushed outward.
This bone here, called the metatarsal, starts to come out.
Here's an x-ray of a mild bunion on the left, a more severe one on the right. And here's a range of what they can look like, from mild to severe. When a bunion is severe and painful, surgery is often the only solution. But Dr. Blitz has 5 quick ways to try and avoid surgery and keep your bunion from getting worse. First, a splint you can wear at night.
And essentially, it's just going to hold the big toe in the right position, in a stable position, while you sleep. Another thing to do is in your everyday work life is to wear some sort of arch support.
This will also increase stability so the bone doesn't move further. You can also try a toe spacer.
This is really great if you have a mild bunion, because you can see what that's going to do. It's actually going to prevent the big toe from going over in general.
And to prevent pain, this is a bunion pad. It cushions the bump. And this is a combination of the spacer and the pad.
If you try to put your foot into a high-heeled shoe, you'll see that you'll have a lot less pressure on that area.
And of course, it's best to limit the amount of time you spend in those high heel shoes, as we all know.